Oman, a country of rich culture and nature. Since Sultan Qaboos seized power in 1970, the country has tremendously changed. One of the main aspects of this change was in healthcare. The life expectancy increased from 49 to 76 in just 5 decades. According to the WHO, Oman is currently ranked 8th worldwide in healthcare. With this documentary, we try to find out how this change occurred. Our first question is, how was the healthcare organized until 1970, so before the Sultan?
Well, first of all, thank you very much and welcome to Oman. We are really pleased having you around. And also special thanks for your interest in the healthcare system in Oman. Before 1970, actually, the healthcare system in Oman was quite rudimentary. There was no much organized healthcare system. The vast majority of the country has been served through traditional medicine, and only in the capital we have which can be considered a modern hospital, which has been operated by a missionary from the United States, so the American missionary hospital. It used to be called Knox Memorial Hospital, or Al-Rahma Hospital in Arabic, which means the Mercy Hospital. And it used to be run by Dr. Tomes and his team. It was established from 1939 till 1970. And then from 1970 onwards, things has changed dramatically.
Although with this development, there are other developments when we talk about vaccinations, about the preventive. Before, the roads were inaccessible cities because there were no roads, so you can see that people, the visits were really tough, and people to have an outreach to those remote areas was really.
So the communication network is the most important.
I mean, that was also on top of the challenges which we had, and you can imagine that. Now, because of all facilities, if we take vaccination as an example, you can see that the coverage of vaccines now, it is almost 99%. But because of all these challenges at the beginning of 70s, or even though 80s, it was really very low coverage. Maybe Dr. Sham, it was
around 10% in the past.
Yes, so you can imagine from 10 to 99% how that, and even the reduction in diseases. If we take measles, during that time it was in thousands. Now you can say it's 3, 4, 5 cases, 6 cases. So it's just a few with the development. However, now again there must be always in life challenges. So there are new challenges, Dr. Sham, and I think we have discussed this before. That there is a shift from infectious or communicable disease to non-communicable. So again, because of life sedentary cars and people not tend to
lifestyle
exactly changes. So obesity has been increased, cardiovascular has been increased. So now we are into what we are calling it in our epidemiological science is the transition and the shift from non-communicable from communicable to non-communicable. And I think really we admit that there are really new challenges, which is really now it's worth to be also invested in. And recently, there is the Minister's Cabinet has adopted a non-communicable strategic framework. So from looking into how to overcome and mitigate these non-communicable diseases, for instance, building sidewalks, improving the road accesses, and what else can be promoting physical activities, healthy diet, reduction in sugar or reduction in salt intake, or even in dietary. So there are remarkable concern from the decision makers and from the authorities in order to shift. But again, the person who should be important. He should feel that also he has to drive the change, and he has also to have it and to consider sport as part of his life, as something which is really important to carry on, like sleeping. It should be part of his life.
Yeah, true. But our department mainly deals with communicable disease.
Yes.
So,
yes.
in terms of achievement of communicable disease is that most of the vaccine preventable diseases, all of them are under control, and many of them have reached the stage of elimination or eradication. Polio, as you know, we had the last case of polio in December 1993. Diphtheria was 1992. So neonatal tetanus is no more. And pertussis, meningitis, because of Hib meningitis or pneumococcal meningitis, all have reduced a lot. And again, tuberculosis also is on the decline. So most of the communicable diseases, there has been a very, very visible impact. And that's the reason we say that Oman has been appreciated, that within a short span of time, we have achieved a lot in terms of improvement in various indicators, demographic indicators like infant mortality, childhood mortality. These have reduced over a very short time, and in terms of very short, not so much of investment. That's why it says that in this WHO report, which is published in 2000, you will find Oman being ranked very high, number one in the performance. And performance, they say, is how much you invest and how much you get out of it.
Yes.
So if there may be countries investing more but not getting the results. But here is an example of a country where the investment has been such that it has directly resulted into a great improvement in the health of people.
About the sustainability of healthcare. All citizens of Oman have free healthcare.
Yes.
You also don't pay taxes or
Yes.
parking money. But healthcare is currently free for all citizens. But how sustainable is this with the current outlook on economy and the future?
Well, it is a concern. I'm not an economist, but it is a concern with the drop of oil prices. But what the country is working on now is diversifying the income of the country to lessen the dependence on the oil money, and hopefully these efforts will be fruitful and result in diversifying the income. So far, we are holding. We don't know what's going to happen in a few years' time. But His Majesty is very clear: healthcare and education are non-negotiable. They have to be for free. This is the main vision of the country, and I think it's going to stay there for some time.
And what do you think yourself? Should like at some point a tax be introduced, or is it a basic human right, and should everybody have access to healthcare for free?
Well, I think what could be introduced rather than taxes is insurance, for example. So privatization of the healthcare system, where people pay insurance, or the government pay the insurance company, and the insurance company pays for the people. This is just one suggestion. I don't see it happening now because so far things are going well, despite the deficit. But there is definitely room for health insurance to take the place of the government in providing the healthcare, for the free healthcare. Taxes, I don't think it's going to be implemented anytime soon. There are certain taxes which is like in the trading sector, in business, but not on the income.
Not on the income.
Not on the income.
That's very handy and beautiful.
Yes, I hope it stays this way.
Wish someday we will have the same in our country.
Hopefully, yes.
You've already answered the next question about the insurance system.
Yeah.
Could you explain the plans for the future? Like, what are the current objectives of healthcare in Oman? What are you trying to accomplish?
So currently what we're doing is we are training a lot of Omani doctors. We have the Oman Medical Specialty Board, which is a training board or training body that takes care of training doctors and making them eligible to practice on their own. We have about 18 different specialties in the Oman Specialty Board. In addition, we're also sending doctors abroad to also get to do residency in other countries like Canada, UK, the States, Australia, Singapore. And so the eventual vision is to provide tertiary level care in almost all the country. So there should be centers of excellence in each region to serve as many people as possible. We rely a lot on the Omani people. We are trying to lessen the dependence on foreign experts for obvious reasons, because it is more sustainable to train Omanis rather than bring experts from outside. We're very thankful for all the people or non-Omanis who helped in the establishment of the healthcare system, but for sustainability reasons we need to train Omanis, and this is the main vision of the healthcare system here. And of course the other vision is the buildings, so not only the human resources but the buildings. So the Ministry of Health is working on building big centers, big hospitals in every region, and slowly developing those centers into more specialized centers. The old hospitals are being renovated as much as possible. So that's the main vision in healthcare in Oman.
It's a very clear vision. Thank you very much, Dr. Hani.
You're welcome.
I would like to shake hands with you.
Sure, thank you.
Thank you for your time.
Thank you.